Hello, everyone, and welcome to today's edition of Wellbeing Live, hosted by the Mental Health Center of Denver. Wellbeing Live is a series of short virtual talks, workshops, and classes given by our experts from across the organization on topics to help support your well-being and the well-being of the people around you. My name is Paul Christensen, and I work in the Development Office here at the Mental Health Center of Denver. Today, we are very excited to hear from Steve Fisher, our Director of Outpatient Expansion and Special Projects, who will talk about compassion fatigue. Before Steve gets started, I'll just remind everyone that if you have questions throughout Steve's talk, feel free to post those in the Q&A chat in the upper right-hand corner of your screen. And with that, I'll invite Steve to take it away.
Thanks, Paul. Good afternoon and welcome everyone to today's segment of Wellbeing Live. As Paul mentioned, I work at the Mental Health Center of Denver as a Director of Clinical Services. I've been at MHCD for over 20 years and gotten to work in a variety of clinical roles and also in a variety of leadership and management roles. And I currently get to oversee a number of special projects and make sure that clinical staff are trained as effectively as possible so that they can provide evidence-based practices and provide therapeutic services to the people we serve so that they can both recover from their illness and create well-being in their lives. So it's a privilege to work at MHCD, and I'm so grateful for the years that I've gotten to be there. Today we're going to talk about compassion fatigue. So this is something that certainly is on my radar as a supervisor of clinical staff, but it's also relevant to anybody that's in the healthcare system as a healthcare worker, as well as people that are deemed essential employees because they're kind of out in the community face to face with people during this current pandemic. And it's also actually appropriate and potentially impactful to all of us who are currently existing in today's culture, again, because of the pandemic. So the first slide that you'll see in front of you gives a little bit of an overview of what compassion fatigue is all about. It's basically, it develops from secondhand exposure to the trauma of others. So again, you can see where healthcare workers, essential employees, certainly therapists, case managers, anybody across the spectrum of healthcare would have the potential of having this exposure to people going through extremely difficult times because of the pandemic. Notice that the risk of compassion fatigue is increased by repeated exposure to the people they're working with trauma. And then also in this more professional setting, the repeated exposure can slowly skew a sense of normalcy in one's worldview. So the person, because they're so inundated with this trauma, they begin to start to feel overwhelmed by it and can start to feel that their worldview has started to change. Maybe they have a very optimistic, the glass is half full perspective in life, but now they're starting to see that start to change. Although a lot of times they don't see it happening, it just starts to happen. So again, this overexposure to people going through difficult times and in fact traumatic times is creating even a shift in their worldview. Notice those last couple sentences too. The more intense and personal the type of care that the person is providing, the more vulnerable that person is to compassion fatigue. So again, the closer proximity, the repeated incidents of this exposure can really increase the likelihood of this. And then notice too, and this is where I kind of harkens back to what I said in my introductory comments, this exposure can happen to both in a personal setting and a professional setting. So this can be true of any of us that are tuning in today, not just because we're healthcare workers, but because we're alive and existing in our current situation, in our current society. So we really want to have an understanding of it today. And then we also want to know how can we take care of ourselves so that compassion fatigue doesn't kind of take over and skew our worldview and bring down our overall well-being. So the next slide that we're going to look at will give us a little more description of what compassion fatigue kind of looks like in a person's life. So there's emotional and physical exhaustion usually that people will report as a result of this exposure, and that in turn results in reduced empathy. So the person who is normally, say, in the healthcare field because of their value system of wanting to help others, they're now finding themselves burnt out. They're now finding themselves unable to feel empathy and care and energy and motivation to help another person because they're so overwhelmed by the needs and other people they're being exposed to. Notice that the statistic of healthcare workers that experience this is between 16 and 85% of healthcare workers have some degree of compassion fatigue. And of course, especially during our current situation, you're going to see that number is going to hold true. And again, remember, this is not just healthcare workers, but it's all of us being exposed to the news, being exposed to a loved one who's going through maybe a positive, being tested positive for COVID, maybe being hospitalized, et cetera, et cetera. We're all kind of in this together. There's a sense of isolation from supporters sometimes that people experience when they're going through compassion fatigue, where maybe the people that can support me and do support me just can't quite be there for me in the way that I need them to be. Not because they're not being supportive, but because I'm so overwhelmed, I can't benefit from the support I normally get from them. Notice it leads to feeling burned out, a sense of depression, sometimes feeling overwhelmed. There's increase in anxiety and very importantly, a sense of hopelessness. A person can experience a decreased sense of accomplishment and or meaning in their caregiving. Again, that's a lot of what drives people across the healthcare industry, is that I get to make a difference in people's lives. But at some point when the need is so overwhelming, they can feel that sense of overwhelming and start to, as is the next point, start to question their professional competency, start to wonder if I'm actually even making a difference in people's lives. Am I actually living out my values? And so then that starts to eat away at their motivation and their sense of hope, because that's what, again, drives a lot of people in the healthcare industry's ability to do what they do. Notice that it can also impact personal relationships. So that can be your personal, or it can be your personal or professional relationships, where you start to either be irritable with someone, or you start to distance yourself, or what have you. So it has an impact in your life overall. And an example of how this could play out in a work environment is, say, again, during this pandemic, there's not, at least initially, there was not enough PPE, professional personal equipment, and then there was protective equipment, and then there was limited hospital beds, or life-saving equipment was sparse. There's too many patients, there's too many people passing away, and those folks that are dying in isolation. Their family members can't be there. So again, it's kind of an assault on a person's value system. It's like, no, we want to have all that is needed to provide and to provide the provisions that are needed for folks that are going through this, and we just don't have that. We're at the limit of our resources, and then that's when I'm starting to feel exhausted. I'm starting to feel burned out. I'm starting to feel like my efforts aren't making the positive difference in people's lives that I'm used to. So again, all those characteristics start to appear in a person's life. And then the last point on this slide is just simply that if you've read articles or heard things in the news, you might hear the terms vicarious trauma, and or you might hear the term moral injury. And those are similar concepts. And it's where I am essentially experiencing vicariously the trauma of another person because I'm so exposed to them, I'm so close to them. And or also that moral injury, which is kind of that idea has been created in the more medical side of the healthcare industry, where you're not able to live out your values. So again, a lot of similarities between those concepts. So on the next slide, we're going to talk about the symptoms of compassion fatigue. And so this is going to be somewhat similar to the last slide in terms of what you're going to see kind of exhibited or manifest in a person's life. So a person who's going through compassion fatigue is going to see a decrease in their concentration. They're going to maybe have a sense of emotional numbness. There's going to be a sense of helplessness, which we mentioned. There could be some irritability, which again, we kind of alluded to in terms of the relationship impact. There's going to be, in some respects, a decrease of self-satisfaction. where, again, I don't get that sense of accomplishment. I don't get that sense of satisfaction from doing the work that I do. And therefore, I'm kind of depressed, or I'm discouraged, or I'm anxious, or I, again, am questioning my competency, etc. There could be a withdrawal, and the withdrawal could be certainly physical withdrawal, and we're already doing that because of social distancing / physical distancing, but there could also be a withdrawal emotionally too, where I'm not as available to my partner. I'm so exhausted that I can't do my normal kinds of connections with people, and even during this time frame where we're doing that more virtually, I'm not even doing that. I am just kind of shutting down. I'm isolating. I'm feeling more and more kind of hopeless and depressed. And then in some cases, there's physical pain. Some people's compassion fatigue could manifest itself as physical pain. There could be an increase in absenteeism in a person's work setting. And then there could also be some sleep disturbance, insomnia of some sort. So again, those are all things that we would want to look at in ourselves and say, if we're noticing that, we just want to have that self-awareness. And then we want to start doing some things, which we're going to talk about in a little bit, to try to change that trajectory in our life. I'm feeling some of the symptoms of compassion fatigue. I recognize that, and I want to do something to head that off at the pass in terms of it having a significantly negative impact on my life. Interesting when we're thinking about the slide and actually this whole concept, once we notice that the pandemic from a public health standpoint starts to go down, as the curve starts to bend down, what the projections are is that the emotional pain is going to start to go up. So people have kind of held it together in our societies, and certainly speaking of in our American culture, we've kind of circled the wagons. We've kind of marshaled our resources to do what needs to be done to stay safe now, take care of our families, take care of ourselves, adapt to a new work situation, maybe go through the loss of a job and applying for resources to help supplement me and my family financially. So there's a lot of effort that's been made right now, or over the last 2.5, 3 months, to just kind of focus on the moment. But the belief is that as time goes on, that emotional distress that we've kind of kept bottled up is going to start to emerge. And that is true again for healthcare, essential workers, and for the society as a whole. And that's pretty consistent with kind of grief and loss and adapting to circumstances that have changed in our life. Is we only kind of dole out the amount of emotional distress that we can tolerate in the moment. And so a lot of that gets bottled up for the time being. There's also an organization, it's called the Wellbeing Trust, and they are a public health organization, and they're projecting that over the next subsequent handful of months, as the pandemic again continues to be the public health side starts to be controlled, there's going to be an increase in substance use. There's going to be an increase in potential for deaths by suicide. And recently there were 2 healthcare providers that died by suicide. I believe one in California and one in New York, I believe. One was a med tech and one was, I think, a physician. And so that idea that, yes, we've again worked really hard to deal with the pandemic in front of us, but then the stress that's going to come, or that has come, is still bottled up, and it's going to start to emerge. And so that's what we really want to keep an eye out for our family members, our loved ones, our community, neighbors, anybody that we know that might start to show some of these signs. And that's why we spent the time in these last few minutes to really kind of zero in on them. So the good news is that we don't have to stay stuck in the symptoms of compassion fatigue, but we can actually do things intentionally to kind of ward off or to manage effectively compassion fatigue and to actually increase our well-being. And so the next slide is introducing that concept of creating a lifestyle of well-being. Hopefully all of us are doing that on a regular basis. We're intentionally doing things based on our self-awareness of what works for us. We're creating a plan that creates well-being in our life. So for example, in this one, exercise, if you look in the upper left-hand corner, doing exercise on a regular basis so that you can, again, have all the spin-off benefits of some kind of movement and some kind of exercise. Acceptance is the next one that's kind of at the 12 o'clock. It's basically just accepting the things that you can't control, but then recognizing the things that you can change and you can control, and then putting forth the effort to make positive change in your life relative to that home project that you've got stuck on and it just bugs you every single day that you see it, or that relationship stressor, or the situation at work or what have you. It's not staying stuck, but moving forward in a positive way. And that whole concept of radical acceptance. I can't control this, so I'm going to radically accept it and move forward adaptively. But the things that I can affect change on, I'm going to move forward and change in those areas. Notice that social supports are really important, so continuing to strengthen those relationships, because relationships are a key thing for us from a standpoint of, in all respects, obviously, as we talked about before, that they can not only provide support for us, but we can also have meaning and purpose in terms of how we treat others. Assertiveness, time management, making sure that we're happy with the way that we're doing the things that we're doing, that we're happy with how we spend our time. And certainly during this COVID-19, there's been a lot of shifts where people are able to, again, I mentioned work on home projects, read more, do things that they normally couldn't do. So being able to adapt to the circumstance and use your time as wisely as possible and as in accordance with your value system as possible, so that you're like, hey, I'm not just flittering away this time, but I'm actually doing something that adds value and adds meaning to my life. And again, a big part of that, back to relationships too, is I'm giving back. I'm contributing to others. Self-talk, the big thing here is so much of what we do in our life is based on our core beliefs and our core values. And if our self-talk is negative, that has a huge impact on us going down the road of anxiety, depression, shame, etc. If our self-talk is no, it's positive. I can do this. I can pull this off. I can be effective in this relationship. I'm competent in my job. I'm a lovable person. That makes a huge difference in our well-being. And then again, relaxation, doing things that allow us to relax, take a break, limit our time, limit our screen time, budget our time in a way that we're able to relax. And then the last one on this slide is just nutrition, making sure that we're getting adequate nutrition to maintain the level of activity that we want to maintain. And I would even add to that hydration too, is another big thing. So that's just a quick little overview of what we can do in different categories of our life to create well-being. And that's essentially what we need to do whenever we're facing any kind of distress, period, but certainly any kind of distress related to the topic we're talking about today, which is compassion fatigue, is I need to use my self-awareness to recognize that something's going on. And then I also need to use my strategy, my well-being action plan, if you will, my way of creating well-being in my life to counter those symptoms, those negative emotions, those negative thoughts that are taking me down a path that are going to erode away my well-being. So that's our encouragement certainly to you, is to definitely do things intentionally to create well-being. The last slide that we're going to look at today is in the category of, if my well-being plan that is all, well and good and well thought out isn't sufficient, and I'm still feeling distressed to the point that I would even consider I'm in crisis. And by the way, we would define crisis as any self-defined crisis. Whatever you would deem as a crisis, then we would say, yep, that's a crisis. And we would want, as a mental health organization and as mental health professionals, we would want anybody who's saying, I feel like I'm in crisis, we would want you to access crisis services. If you're not already in service with like a provider, like a therapist or a psychiatrist or any kind of mental health professional that you could get in connection with, if you don't have access to that person or those resources, then immediately we want you to get in contact with some crisis services. And on the slide here, you have the phone number to the Colorado Crisis Services line, which is 1-844-493-TALK, and that's 8255. And of course, we really want anybody and everybody who's experiencing any kind of crisis to access those services. And if you call them, they will then route you to what your next, what would be the most helpful thing to you. Notice there's a walk-in center there too. If you live in Denver, you could just go to that walk-in center on Colfax and Claremont and just walk in, and they will do the exact same thing that the person would do for you over the phone. So to sum up and to wrap up before we take a few minutes to answer any of your questions, really be intentional about creating well-being in your life. If that's not sufficient, definitely access crisis services. And keep an eye out for anybody and everybody in your life that potentially could be experiencing crisis fatigue or compassion fatigue. And then talk to them, have a conversation and just say, what's going on? How are you doing? Would you like to maybe access something that could access someone who could talk to you and listen to you and help you with what you're going through? So let's wrap up that part of our presentation today, and let's answer some of your questions.
Thank you, Steve. We have quite a few questions actually, and a few minutes left, so hopefully we can cover as many of these as we're able to. The first question is related to something that you talked about a little bit. So I'm wondering if you want to expand in any way. The question is, what should I do if I notice a family member or a friend is experiencing compassion fatigue?
Yeah, I was kind of alluding to it a second ago, but definitely have a conversation with them. Don't avoid the topic, but lean into the topic. So go to that person and say, hey, I've noticed a difference in you. I've noticed you're not as talkative. I've noticed that you don't respond to my text messages like you normally do. And I know you're stressed at work. Hey, can we meet virtually, or maybe now as things are loosening up, maybe meet in public with a mask and social distancing all adhered to. Maybe you could have a conversation with that person. But suffice to say, however you go about doing it, make sure you connect with that person and let them know you care. Ask them honest questions, and then let them know that if they're not in their normal kind of place and they don't have their normal access to their own resources to tolerate distress, then give them access to the Colorado Crisis Line, and encourage them to connect with them and follow up with them. So make sure they aren't left out there on their own. We are doing an initiative at MHCD right now for people that are at kind of a higher risk for suicidality. And so what we're doing is we're calling them and just saying, hey, we care about you. We're thinking about you. We just want you to know that you're on our mind, and we want you to know that we hope that you're doing everything you can to make it through this epidemic in a hopeful and positive way. And the people, and this is over 800 people that we're reaching out to, are incredibly thankful, appreciative. Yes, I'm doing pretty well. Yes, I'm using these skills or these supports in my life to live effectively through this difficult time. So it's that kind of concept. It's what we would call a caring contact. It's just making that contact and staying connected to that person to make sure they get what they need and that they know that they're cared about.
Thanks, Steve. The next question is from Rita. Are there ways to increase resilience to compassion fatigue while still being an effective caretaker?
Yes, there are. A lot of that has to do with the support systems we have around us as treatment providers. Let's say if you're a professional in the healthcare industry, and certainly in the behavioral health care aspect of the healthcare industry, we have built into supervision. We have built into that supervision as a central part of the day-to-day work schedule. And in that supervision, basically what we do is we try to help people build that resiliency. We try to help people learn how to care for themselves while caring for others. When I was new to MHCD over 20 years ago, my supervisor said to me, you're never going to have a problem caring for others. Your problem's going to be learning how to take care of yourself in the midst of caring for others. And so for me, that was exactly what I needed to hear, because I was starting to feel like compassion fatigue. I was starting to feel burned out. I was starting to feel overwhelmed. And so I had to learn, how can I stay true to my values of caring for others while also taking care of myself. And the big part there is, the big thing I had to learn over time is I can never will someone well, but I can wish them well and give them opportunities to be well. And so again, supervision is a huge piece to that. Self-awareness is a huge piece to that. And then doing things intentionally to take care of yourself. So that well-being action plan, or that well-being suggestion that I mentioned earlier. And then the last piece I'll say about this is that sometimes our vulnerability to compassion fatigue is not just what's going on in the moment, but it's what's about my story. So maybe in my life I've had some trauma, maybe in my life I've had some difficult times, and by working with this person and being overwhelmed in this current situation, I'm feeling kind of that residual of my own story coming into play. So the point being there is I need to work on my own grief and loss. I need to work on my own trauma, so that when I'm working with others, that isn't what's getting triggered and coming into play.
Next question is, you've touched on it a little bit again, but wondering if you want to expand on it again. It is, what can I do to not even get to the point of compassion fatigue? So how do I take care of myself more regularly so I can stay present in my job?
Yeah, exactly. It's kind of a reiteration of everything I've said today is, boy, recognize it quick. Be proactive in every way you possibly can. I mean, and proactive just simply means I have a well-being action plan in place. I know what I do every day or every week or what have you to create well-being in my life, in terms of my relationships, in terms of my emotional, my physical, my spiritual, every dimension of my life. I'm very intentional about taking care of myself. So when I go through a stressful period of time, like our current pandemic, I'm already resourced up. I'm already in a good place to weather this kind of storm, to weather this extra distress in my life. And then again, of course, supervision, if I'm in the healthcare field, to get support from my supervisor and to get support from my organization that's going to give me all that I need. Back to that example I gave of, if I don't have what I need, then I'm already 2 or 3 steps behind, and I'm not going to be able to catch up. So yeah, working for an excellent organization, being around a supportive structure in my work, having a lifestyle that's ahead of the curve, and creating well-being in my life.
That's great. Well, thank you, Steve. That's all the time we have for today. But we thank you for joining us today and for sharing your expertise about compassion fatigue and how we can take care of ourselves, especially during this time. And thank you, everyone, for joining us this afternoon to hear from Steve. Again, encourage everyone to share this series with your friends and your family and your colleagues. And we'll post a link to the webpage in the chat. And so we encourage you to go there, view upcoming events, view recordings of past events, and to submit your information to be notified of upcoming events. So thank you all, and encourage everyone to do something to take care of yourself, one of the things that Steve mentioned. And so we'll see you next week.